sitting at the head of the table, and we're going to start once again with effleurage. Come underneath the chin and come up, and then around the cheekbones. Just really, really lovely just to do these effleurage strokes at the start of a treatment of each body part. So I call it a butterfly stroke in my massage courses. It's such a nice thing to do, so the person knows where you are in their body. So do that a couple of times. Right, so now we're going to put our fingertips underneath the submandibular lymph nodes here. So you can see I'm going to alternate. We're going to work our way back towards the jaw. So our pressure is, so I alternate right at the top of the jaw there, underneath the jaw, so it doesn't pull the skin too much. And then, so I alternate them at the top, and then, now the pressure, as I say, is coming back along towards the ear, if you like, the base of the ear. So we're going along, the pressure's going along there as we're going to bring it back towards the line of the jaw there. So you're just going to keep working along there. Remember to keep as much of your pads of your fingers as you can. Of course, it's tricky with Liam being small. I got to just work around it a little bit, but no big deal. So we're underneath the jaw. There's all these lymph nodes there. You'll be able to feel them generally. And so you're going to work along those. So just keep working along that line there. Nice slow rhythms, 5 or 7 repetitions. So let's say we're underneath the jaw. We're stimulating those lymph nodes there. Okay, and now, once again, I'm just going to work down the neck. Pushing that lymph that we've just directed back through towards the bottom of the earlobe, along that jawline, and now help it on its way. You see that we're just helping it on its way there. And now, so we're going to be working our way up the face. So now we're just below the lower lip there, and we're going to work it straight down. Your pressure is straight down, the thrust phase going straight down. You're like inferior, if you know your anatomical terms. I'll just show you there. As you work down, pushing that lymph down to the submandibular lymphatic nodes that we just cleared. Again, I'll just get you a better angle there. Once again, try to keep as much as your fingertip, the pads of your fingers, as much contact as you can, because of course that's going to allow you to stimulate more of the lymphatic vessels. So once again, it's all going straight down towards the clavicles, if you like, and that's going to start dumping those into those submandibular lymph nodes underneath the chin, if you like. So we're just working our way once again out towards the ear as we keep, make sure you get that stretch. You can see the skin stretching straight down. And this is so relaxing, it's incredibly relaxing. Now if I had a bigger face, I would have more of my fingers on the face to get more contact, but Liam's sort of small face. Okay, now once again, with your fingertips, as many fingertips as you can contact, and we're just working out across, so bringing it towards the corners of the mouth, if you like. Bring it out sideways, laterally. And now, once you've cleared that, once again, help that on its way. So you've moved it across the top lip out to the sides, and now once again you're going to help get that lymphatic down to the submandibular lymph nodes. So this is of course great treatment for headaches, for sinusitis. Now again, if you were treating someone with say sinus blockages, that sort of thing, I'd be working a bit more around the nose, as you'll see how I do it. And just concentrate on the areas that need more more focus. So once again, I've moved my way out, and then again, I'm just working that on its way now. So going back to the neck and continuing on its way. So great for sinusitis, as I was saying, for headaches, of course for puffiness, edema, bags under the eyes, puffy face, etc., etc. Now you see here I'm just alternating across the nostrils, once again just pushing it out to the sides there. You can see that. And so you'll work along the nose there, pushing it out to the sides. Because of course we're going to move it laterally, as we're doing now, laterally and down, and then we'll push it down again. The bridge of the nose here, just pushing straight down through there. So as I was saying, I'll talk more about this, but as part of, if you do facials, or even if you don't do facials, this as part of your marketing for getting people, facial rejuvenation, lymphatic drainage, it's such a popular treatment these days. So you can make this as with or without doing a facial. But if it was me, I'd be offering both, but I would absolutely be offering a full lymphatic drainage treatment of the face and neck, and also a luxury facial. You can see that, and now just once again get as much contact. Just remember, soft hands all the time. Remember your stretch phase, your thrust phase, and the relaxation phase. So as long as you remember the direction you have to take, that'll tell you exactly where your thrust phase is. Keeping it, but just keep as much contact as your hands, your fingers, the pads of your fingers, everything, as much contact as possible. Because if you're just using the tips of your fingers, then you're not getting, it's not going to be anywhere near as effective as contacting the whole pads of all your fingers, and even palm of your hand, depending on where you are. So once again, we're going back, submandibular lymph nodes underneath that jaw there, and working them back towards pressure going out, across, towards the earlobe. And so once they're there, we're going to help it on its way down through the neck again. Now I'm giving you a base to work on. You do not have to follow this, stroke for stroke. You know that it's going to be slow rhythms, as I'm showing you. You know you can do about 5 to 7, but if you did 10, no big deal. It just gives you a structure to go by. But around about 5 to 7, and then move to the next section. You could go back, do more on the neck if you wanted to. But as long as you understand the what you're trying to achieve, and just help send the lymph on its way. Once you've cleared a certain area, keep clearing it. Then it's really, you don't have to think, oh, what did he do next? Because once you know where you have to go, what you have to clear, then it becomes, you don't have to think too much about it. But this gives you a structure for when you're starting, by all means. Okay, so we've got the cheekbones here, and we're going to work on the eyes and cheekbones. Now we've got these lymph nodes right in front of the ears here. So this upper area of the eyes, as you learned in the self-lymphatic massage for the head and face, we're going to clear this area now, because these are going to drain into the lymph nodes in front of the ears. So eyes and forehead will go towards the ears because of that watershed. So we're going to do just underneath the eyes, very gentle pressure. You'd need to check if someone had contacts to make sure they're not wearing contacts. You would have done that beforehand, because you're going to go on top of the eye in a minute. So this is great for bags, sagginess, and bags underneath the eyes, puffy eyes, that sort of thing. These are directing towards the ear. So everything you're seeing now is going towards the ear. So the first thing I did was clear the ears there. So where the ears were, to clear towards the ears to stimulate those lymph nodes and clear those nodes. And now we're bringing all of these towards the ear. Now, this is just on top of the eyeball, incredibly light pressure, and again going towards the ears. Now, because my hands are so big compared to Liam's face, I would generally use the ring finger if I were you, because it's classic, the weakest finger, and so you're not going to. It's probably better for you to use that ring finger, but whatever's most comfortable. I couldn't do that because my hands get. I don't have enough room between both hands when I get close to his eyeballs to use my ring fingers. Anyway, so do that, and then you clear. So now we're going towards the forehead or forehead, however you like to pronounce it. So, yeah, I'm just clearing those nodes at the ears there. So now I'm just working down towards the, so I'm pushing those lymph nodes now down and clearing it, helping it on its way. So, and now down through the neck there, down again towards the clavicles. Again, helping it on its way, clearing a path. You see a nice slow rhythm. And another spot on the neck. Okay, so now with the forehead, so you don't sort of stretch as I showed you in the self one, it's just alternate. Now again, I'm just using my fingertips because Liam's head's small, or you know, the pads of my fingers up to about the second joint. You could use all your fingers, the pads of all the fingers, even the palms if you wanted to, and direct them out to the sides, down towards the ears. What we're going to do, these lymph vessels go down to the, as I said to you, to the lymph nodes in front of the ears, and then from there they go down into the neck and into the terminus area. Of course, this is great treatment for people that suffer with headaches. You know, if they're just, you know, they're foggy, they're just having problems concentrating. So now I'm just using my palms, or the heels of my hand and palms, and I'm just working the scalp there, again down towards the ears. And once again. As you can see there, just clearing it all. My son was just dozing off as we were doing this. It is such a relaxing treatment. I used to do lots of treatments with this for pure relaxation. People would just love this for the relaxation that it provides. Of course, all the other benefits as well. So now, to clear the terminus, I just got to come around here. So I'm going to go work through the neck again, because it's hard to clear the terminus from a seated position. So you just have to get out of the chair, come to the other side. Just come to the side of the table where you can work that better and just clear all that out. All of that work that you've drained from the face. So yeah, think beauty treatments, think headaches, think sinusitis, hay fever, but again, as a great spa treatment, couple it up with a facial, you know, whatever you like, a standalone treatment. So then finish it off as you do. You start with the effleurage and you finish with the effleurage. And then I just put my hands there as nice, you just